Welcome back to Doctors in the House. My name is Dr. Darrell Hill, and of course, it is my pleasure to once again be in the house with you. As you all know, I am a part of Laurel Medical Associates, and providing care and helping keep people healthy is what we do. Today is a special day because I had a chance to take a moment and have a wonderful program at the fabulous Woodmore Country Club. Had a chance to have a public forum where we had an opportunity to talk about high blood pressure and diabetes. And for all those people who came out for this incredible event, I want to thank you. Today we're going to talk more about hypertension and diabetes and kind of reflect upon what we talked about in the program. As you all know, high blood pressure is a really serious issue in our community. In fact, over the past 2 years, there have been some serious updates to high blood pressure management. And I really want to make sure that we as a community are aware of these changes, especially given some of the current events recently of celebrities who unfortunately passed away from complications of high blood pressure, which include stroke, heart attacks, things of that nature. So I'll be running my presentation today off of an earlier public forum that was done. So bear with me as we do this for the first time. So we all know that high blood pressure affects everybody. It doesn't make a difference, young, old, black, white, every demographic. However, for African Americans especially, we see some of the worst health outcomes you can expect from high blood pressure. And we'll get into why we see that. So just to remind everybody, blood pressure is the force or pressure of the effects of the heart contracting, and that leads to what is called your systolic blood pressure. That will be your top number in that blood pressure. And the bottom number is when the heart relaxes. That would be your diastolic. So usually when we talk about high blood pressure, we're talking about the systolic and the diastolic, which is very important to understand. And the reality is both of those numbers are very important. Throughout our day, blood pressure naturally will go up and go down based off of what you're doing. If you're rushing to a doctor's office, if you're angry, if you're in traffic, if you're in pain, all those things are natural things to cause your blood pressure to increase. So just remember that. So when we read your blood pressure readings, we want to be real careful to get as accurate a blood pressure as possible so that that information can be used appropriately. So you don't know if you have high blood pressure if you're not checking your blood pressure. So it's very important to make sure you're checking your blood pressure. Some people get it checked 3 times a week. Some do it once a week. Some do it once a month. Some do it every 6 months. Depending upon who you are, you've got to decide upon the frequency with your doctor to do what's best for you. But again, make sure you're getting it checked and make sure your blood pressure cuff is the right size. I find that there are some people who are bigger than others and your arms might be really big. If that cuff is too small, it will actually increase your blood pressure readings inappropriately. So make sure you have the right size for your blood pressure cuff. So just as a review, the new recommendations for blood pressure have changed 2 years ago. So normal blood pressure, for those out there, you should know, is less than 120 over less than 80. Used to be that we would tolerate blood pressures of 140 over 80 and 90, but now with the new guidelines, that's considered a concern and approaching high blood pressure that may require treatment. Of course, as blood pressure gets way above 140 over 90, we've got to really think seriously about what we can do to get those numbers down. The new guidelines are there to help identify people with high blood pressure and to help begin treatment when appropriate so that we can avoid some of the serious complications. And I'll be the first to tell you, These guidelines have now led us as a country to going from about 33% of all adults having high blood pressure to now close to 46%. So almost 1 in 2 people, adults, have high blood pressure. And many of these people are some of the younger people who I see every day in my office and who are seen around the country in different settings for the same reason. So some tough decisions had to be made, because the reality is many young people don't want to take medications unless they really have to, which is appropriate. But make sure you're making the right decisions about these blood pressure readings and other healthcare issues. So as we all know, blood pressure is serious is because it can lead to heart disease, it can lead to stroke. And as you all know, heart disease is the #1 killer for all people in the United States. So when we talk about blood pressure, it's important to know that the complications can include eyes, your kidneys, heart disease, heart failure, and a variety of other chronic issues. So when we talk about the blood pressure, many times being a silent killer, we have to remember that we've got to be identifying it, and then we have to make sure we're treating it appropriately. Now, the lady on the screen here just happens to be my mother, and I share with the audience that she was someone who was young, who had high blood pressure at a very young age. And as a result, me personally, I got to witness a lot of the complications with her. Dialysis was the biggest issue she dealt with, but for years her blood pressure was very difficult to control. And despite medications and trying to do right, unfortunately, she had to deal with dialysis. So I think about her a lot when I have these discussions, and I talk to patients and others about the chronic effects of uncontrolled high blood pressure. So for those who might want to know, yes, high blood pressure is very expensive. It costs the country about $50 billion a year to manage high blood pressure. When you think about the medication, doctor visits, procedures, and the disability associated with strokes and things of that nature, high blood pressure is a very expensive issue, which is why we want to hopefully avoid complications of high blood pressure. So what are some of the causes of high blood pressure? The causes are numerous. High blood pressure can come from your diet, it can come from other medications, it can come from your weight. In fact, even as your kidneys begin to deteriorate, that too can lead to high blood pressure. And the sleeper that no one talks too much about is sleep apnea. Sleep apnea can lead to some of the highest blood pressure readings you can ever see. I've seen blood pressures as high as 200 plus over 150, largely related to sleep apnea. So we'll talk more about sleep apnea some other time, but just be reminded that for young people, sleep apnea, which is associated with snoring, can be something we got to think about when it comes to blood pressure, especially when it's not being controlled despite medications. So what are some of the signs and symptoms of blood pressure elevation? A lot of times you won't notice anything different. You're going to feel totally normal. So that's why it's called the silent killer. But you're right, sometimes there can be headaches, there can be problems breathing, and you might even be surprised to find out there are abnormal lab tests with your kidneys and other issues that surprisingly can result from high blood pressure, of which you had no idea you had. So, as always, very important to maintain an open communication with your doctors and to do the right thing. So we do have a video here right now, and if we're able to use this video, I'm going to go ahead and get us started. Is that cool? All right, so we'll pass on the video. So when we talk about risk factors for high blood pressure, we talked about diabetes, we talked about smoking. We cannot forget about the high sodium diet that we all eat, be it processed foods, be it fast food, be it some of the usual things in our diet like bacon, which we have to think twice about these days. We got to be real careful. And when we talk about high sodium, it doesn't mean you're adding salt to your diet. A lot of times salt is already included in whatever food you're eating. So be real cautious and careful about reading the nutritional component of your foods as you prepare foods and as you eat out. Very, very, very important. So as mentioned earlier, some of the consequences of high blood pressure that's not controlled will include a heart attack, will include strokes, heart failure, even dementia, and you can get problems with your blood vessels called aneurysms, things of that nature. So again, very important for us to be on top of this blood pressure and to be leading a healthy lifestyle, exercise, dieting, and just avoiding those things such as smoking that can get us in trouble. So here you see some pictures of some foods that we really enjoy. I'm sure some of us are seeing these pictures and can't wait for breakfast tomorrow or dinner tomorrow night. And with tomorrow being Father's Day, there'll be a lot of ribs being sold and eaten across this country. Now, I'll be honest with you. I'm not one to say never, ever eat these foods. What I am saying is to be responsible as we pick and choose from a variety of different foods that can get us in trouble. I'll be honest too, I actually gave up bacon. I don't cook it anymore. I might eat it on rare occasions, but like a lot of people out there, I grew up eating bacon and I realize now it's not good for you. So I do my best to stay away from bacon and from spare ribs as well. So begin to think about that if you're not already doing that. I tell my patients a lot that as you begin to make better decisions with your food choices, a lot of our health issues will actually get better naturally. Keeping in mind that when you look at the picture to the right, the French fries may be very good, but from a nutritional standpoint, there's no real nutrition involved in French fries and bacon and for the most part ribs as well. So many people now are moving to a healthier plant-based diet that tends to give us more wholesome nutrients and the calories are not as plentiful and the fat content is going to be better too. Along the same lines, we talk about our sedentary lifestyle. We talk about how now we are a much more sophisticated society with digital and computers that make our life easier. There's less activity, more remote controls and TV. So we got to be real careful because our bodies weren't really designed to handle the amount of calories we're getting now. So I really want to remind people to eat healthy. And if you are doing any fast food restaurants, be aware that with that, the salt content in these meals and the calories in these meals can be enough for an entire day's worth of nutritional recommendations. So you're getting a lot of food, a lot of calories that really don't offer much nutrition and can really hurt you in the long run. So we've talked about dieting, we talked about exercise, and we've talked about weight loss. And I'm going to talk briefly about some of the medicine choices we get into when we talk about blood pressure, because as much as we don't want to use medicine for blood pressure, we do want to use them when they're appropriate. My experience has shown me that people don't want to use medicines unless they really have to, which makes a lot of sense, but they'll begin to make choices on their own when it comes to stopping or not taking these medicines, and eventually it can hurt themselves. So treatment, lifestyle is a huge part of treatment. You're exercising, you're dieting, you're keeping your weight down. But when you look at your medicines, there are about 4 groups of medicines when it comes to treating blood pressure. And one of the big ones happens to be something called ACE inhibitors. Those are medicines like lisinopril. And when you think about lisinopril, they're really a good group of medicines, but 3 side effects you got to know about. You got to know about how these medicines on rare occasions can lead to coughing problems, and we still need to monitor your blood work. And there's a rare condition called angioedema, which can lead to swelling of the face and tongue area. And it really scares people, but I find that you got to at least tell people about this, because ultimately, if it happens, which it normally doesn't, but if it does happen, they'll be aware of it and can simply stop their medication and consult with their doctor to get better recommendations on how to handle it. But again, very important medication. Many people are aware of diuretics, also called fluid pills, which help to control blood pressure. And keep in mind, these medicines don't work well if you're taking in too much salt in your diet. So very important to stay away from those high salt diets. Also, there are calcium channel blockers and beta blockers, which help to manage blood pressure. And just so you know, many people these days have to be aware that it takes multiple different types of medicines these days to help control blood pressure. So one medicine these days can have 3 or 4 medicines combined, and that tends to make it easier for people to take a medication. If you take one medicine with 4 in it compared to 4 by itself, some people can have a higher compliancy rate, which is really important. Just so you know, there's something called a DASH diet, and this diet actually encourages a low sodium intake and includes a variety of foods like vegetables and fruits and low-fat foods, and it's been proven to really help with blood pressure management. So for those out there, don't be afraid to look up DASH diet, or even feel free to contact me and I can give you further resources, because this diet by itself can really help treat blood pressure. In addition, there's something called the Mediterranean diet, which is also thought to be a heart-healthy diet, which can help your blood pressure. So we've talked about the consequences of blood pressure, which includes heart attacks and strokes, heart failure, kidney disease. Many people are aware that a celebrity, multiple celebrities recently have passed away from complications of high blood pressure, including John Singleton. We do have a video here, and we're not going to be able to show it at this time. What I'm probably going to try to do is go to a break and show 2 videos on blood pressure, and if we're able to, talk a little bit about diabetes. So once again, I want to thank you all for joining me today on Doctors in the House. I can be reached at Laurel Medical Associates, 301-497-0401. Also at laurelmedicine.com, laurelmedicine.com. And thank you for watching Doctors in the House, and we'll be back with you in a second. So, All right, so we are live once again. The doctor's in the house. My name is Dr. Darrell Hill, and welcome. It's good to have you back here. Today we're talking about high blood pressure. We've had quite a bit of issues. We've had quite a bit of issues going on in the media with issues with hypertension, including Mr. John Singleton, famous director. And we're going to have a brief video on him once we get it queued up. But we're ready? All right, let's go to it.
My senior year in
John Singleton was a trailblazer who broke ground in cinema as a black director, despite storied feats, which included being the youngest person ever to receive a Best Director Oscar nomination. Singleton quietly struggled with high blood pressure, a condition that affects more than 100 million Americans, with African Americans most at risk. Research shows hypertension starts earlier and is more aggressive in the community.
And they have worse outcomes, such as heart failure, kidney failure, and stroke.
In his case, Singleton suffered a massive stroke 2 weeks ago, his family making the decision Monday to take him off life support.
In the 120s, over 80s.
Dr. Isilma Fergus, a clinical cardiologist and associate professor of medicine at Mount Sinai, cites risk factors like a high sodium diet and excess stress to the uptick in cases. Apathy also playing a role.
You got to remember that hypertension is silent initially. You don't feel hypertension. So the blood pressure may be elevated, and people may ascribe it to just not sleeping enough that particular night.
Reacting to Singleton's untimely passing on the Pix 11 Morning News, director Dion Taylor says it's a wake-up call.
Man, for every black man in America, man, check your health. We're the people that we don't do it. But we think we're so strong and we just don't go to the doctor.
Singleton, who is survived by his parents and 7 children, will be laid to rest later this week. His family now on a mission to educate others on the dangers of high blood pressure. In the newsroom, I'm Andrew Ramos, Pix 11 News.
So we're back with Doctors in the House. I hope you all had a chance to enjoy that important video on John Singleton and the advice and recommendations. I agree that we as people need to make sure we are taking care of our blood pressure, going to the doctor, and being a little more proactive in how we approach managing our blood pressure. So I'm going to talk a little bit about blood pressure in a review format as we wrap things up with a video. Once this video is queued up, just let me know. But we've spoken today about how we define blood pressure. Less than 120 over less than 80 is considered normal blood pressure. With the recent changes in blood pressure definitions, we now have close to 1 in 2 people having high blood pressure. So very important to get your blood pressure checked and to watch your diet, your salt intake, make sure we're getting our exercise, because ultimately, if we're not doing these things and we have high blood pressure, we could actually have complications. Complications can include kidney failure, strokes, heart failure, and in many cases, we can do things early on to help prevent this from progressing to a more serious issue. Controlling our weight, avoiding fast food. And I got to remind people that as we get older, our blood pressure actually increases too. So let's not forget that. Many of us are aware of the increasing numbers of dementia cases taking place. And many people may not know that even dementia, certain types, can come from high blood pressure. This question came up today in our session, and I was glad that we were able to talk a little bit more about it. How are we doing with that video? So we talked about dietary issues when it comes to our bacon and meats and French fries and fried food. So let's continue to make the right decision and make some lifestyle changes that can be very, very helpful for our health. We've had a chance, too, to talk about the different types of medicines that can be used for blood pressure. ACE inhibitors, diuretics, calcium channel blockers, beta blockers, all these medicines can help control blood pressure, and they can be associated with possible side effects, which tend not to occur too often. But the value or benefit of these medications tend to outweigh any risk that we may be concerned about. But again, just makes a lot of sense to be under the care of a doctor and helping to monitor these issues. And very importantly, we had a chance to talk about the DASH diet. This diet is very important in helping to decrease the amount of salt in your diet and includes a variety of foods such as vegetables, fruits, and low fats, which can make it easier to help prevent possible high blood pressure. So at this point, we're still waiting for this video to pop up. If we're not going to get the video, we may just move on and talk a little bit about diabetes since we're having some difficulties here. So moving on to diabetes, which is another topic we talked about today. There are two types of diabetes, type 1 and type 2. Type 1 tends to be associated with a need for insulin, happens in younger people, might be considered more serious, and without insulin, you're in pretty bad situations. Type 2 tends to happen as we get older, can happen as we also put on weight, and can respond to weight loss very well. And if needed, pills or oral medication can be very, very helpful. When you're trying to find out if you have diabetes, some of the classic symptoms of diabetes might include blurry vision, drinking a lot and urinating a lot, and even rapid weight loss as well. So over the years, I've had a chance to diagnose people based off of these findings. But more and more these days, we're dealing with epidemic proportions of people being diagnosed with diabetes and with something called pre-diabetes. Our diets these days are so high in sugar that many of us aren't even aware that we're creating diabetes on a daily basis. So in many cases, we're going to the doctors, getting blood work done, and being told our sugar levels are high. And in many respects, that begins to meet the criteria for a diagnosis of pre-diabetes. I've been able to see this diagnosis turn around completely with people making changes in their diets, staying away from the fruit juices, backing off on the candies, backing off on the chips, backing off on the processed foods. And before you know it, this pre-diabetes is changed and helps to avoid an outright case of diabetes. Currently, we have 30 million people in this country with diabetes and another 90 million with pre-diabetes, and upwards significant amounts of people who are pre-diabetes within 5 years will become diabetic. So very, very important. So when you are going to the doctor, if you are diabetes, very important for us to monitor your lab work, your cholesterol, your urine tests. You can actually find evidence of kidney damage in your urine before it begins to show up on your blood test. Getting simple tests like EKGs and ultrasounds, and if needed, a stress test can be very helpful in managing your diabetes. Because of the kidney involvement and possible heart involvement issues, a lot of times you may be seeing a nephrologist and you may be seeing a cardiologist or even a foot doctor, a podiatry person. Very important. So when we look at how we manage diabetes, it still gets back to lifestyle changes, much like our high blood pressure situation. Our diet's going to be important. Exercising is going to be important. For those with type 1 diabetes, you will require insulin in most cases, and insulin comes in two different types. One will tend to be a long-acting insulin that you might take once a day, and another one might be an insulin you take with your meals. So these are the ways we help to manage type 1 diabetes, and by doing so, we can help prevent some of those horrible complications. Now, when you look at type 2 diabetes, if needed, a lot of times you'll be taking pills to help control those sugars. But keep in mind, if the pills don't work, those situations may require insulin as well. Some of the big complications of diabetes include kidney and eye problems, heart problems, circulation problems. As many may know, diabetes is the #1 cause of dialysis and blindness, and a good number of people can have amputation and heart issues as well. So one of the most important blood tests with diabetes will be your hemoglobin A1C test. This test really should be less than 7. As you get into the 9 range and greater, that suggests that your diabetes is poorly controlled. So, and if that's not being controlled, it increases your risk and chances of having further complications as you get older. Some of the common medications for diabetes include metformin, lisinopril, insulin, and even a cholesterol pill. A statin is important too. These things help to prevent cardiac problems, stroke problems, and many people will take these for an extended period of time to help prevent issues with their heart and their brain and their cardiovascular system. So there's a lot of talk sometimes about these medicines, but in my opinion, they have more value than any adverse effects, and they will be recommended to help prevent some of the more common causes of serious medical issues for people. So I don't know where we are now with our videos. I know we're wrapping up the show. But at this point, I guess I want to thank everyone for joining us today. Hope you learned something with Doctors in the House. We had a chance to talk about diabetes a little bit, a chance to talk about high blood pressure. These both are very important issues, but more importantly, we had a chance to talk about our everyday habits when it comes to eating and exercising that will translate into better health outcomes. So let today be a day where we take another step forward to improve our health and do the right thing. And once again, I want to thank all those people who came out to Woodmore Country Club for our health and wellness seminar. I really enjoyed your enthusiasm, your participation, and your love for life as we came together to help you help yourself. For those of you who need to reach out to Dr. Hill, yours truly, I can be reached at 301-497-0401 and also at laurelmedicine.com 24 hours a day. Look forward to seeing you all next week, and do the right thing.